quorum. I'm going to move around a little bit on the schedule here. First up, we're going to have Senator Parker with Senate Bill 2739.
Thank you, Mr. Chairman. Thank you for allowing me to do this bill first here. This is a bill brought to my attention concerning non-emergency medical transportation. So for some background, non-emergency medical transportation providers are people who basically take people to appointments who have a disability or have some capacity that limits their ability to get to a doctor's appointment of some sort. And so what this bill would do is it puts some provisions on people providing that service to have some minimum requirements and things in place to provide that service. It will put this under the Department of Transportation, sets these rules. So for example, the standards that would be set would include the qualifications of the drivers, should include that there be a background check done on the driver, including a criminal and sex offender check, that their annual MVR checks with Department of Public Safety to make sure that someone hasn't committed some DUIs or something like that during the year. That would be important. And that drug screen has been done, and that the driver is properly trained on the vehicle that they will be driving. So for example, if it's some type of commercial vehicle, they would have to have certification to drive that type of vehicle. It also would give the Department of Transportation the ability to look at the safety of any vehicles, providing that, requiring the inspections and require insurance on the vehicle. So right now, you may have someone who calls for service to have someone come pick them up and take them to doctor's appointment, and they don't know who's coming to pick them up. And it's come to my attention that there could be some instances where someone is maybe not the best person to be providing that service. And I don't think we have any oversight at all right now that allows the Department of Transportation to look into that, to make sure that our elderly and disabled people are not just out with someone driving without regulation. That's basically a summary of the bill. Be glad to answer any questions.
Are there any questions? I'll entertain a motion then. There's been a motion, title sufficient to pass. All in favor? Aye. Opposed? Ayes have it. We'll report that. Next is 2659. This is a committee sub. This has come to us at the request of the department. In section 1, there's a deletion of General Fund Stabilization Act. That there's no such thing as that, and we substituted state law. And then in section 1 under number 3, this basically allows the department to be in compliance. And then in section 4, it was wording was done to ensure pharmacy payment prior to the stranglehold language being put in. So that's an explanation of the bill. Any questions? Yes, ma'am.
Thank you, Mr. Chairman. So this bill also allows the Division of Medicaid to issue grants under the ARPA monies.
Yes, ma'am, it does.
And are we setting any standards? Are they criteria? Are they the ones who are going to develop the regulations?
I would imagine the department would set those standards.
And what did you say about that we were amending the state plan? Okay, you say if it's disapproved, then it operates under the existing plan.
Yes, ma'am.
Do we know whether they're submitting some, they just needed authorization to be able to submit a plan amendment?
That I don't know. Is there anybody from Medicaid here? Mr. Cody?
So if I remember correctly, your question was what state plan amendment was submitted?
No, I say, are you planning to submit a plan? It says if any state plan amendment is submitted. And so there has been one already submitted?
So we did submit quite a few state plan amendments to comply with the Medicaid tech bill last year. There is one state plan amendment still pending in front of CMS. It has not been approved or disapproved. What this language would do is if that state plan amendment is disapproved, we would revert back to the reimbursement rate for pharmacy that existed prior to July 1, 2021. So what this language would effectively do that it would give the legislature a little bit more, it would allow them to address more Medicaid matters in the tech bill. If it never complies with federal regs or if CMS rejects it, it would allow us to revert back to the methods statutory amendment.
Pre-submission.
Yes, ma'am.
Thank you. Thank you, Mr. Chairman.
Any other questions? Entertain a motion. Title sufficient, do pass committee sub. All in favor? Aye. Opposed? The ayes have it. That bill will be reported. Senator Wiggins, if you would be kind enough to do Senate Bill 2448.
Thank you, Mr. Chairman. This bill, the Senate actually passed it last year, actually made it all the way, or I said it ended up to conference, and for just some reasons really not connected to the bill, it didn't make it. Bottom line is that this allows the parole board to parole medically frail inmates to a long-term care or skilled nursing facility. And if starting at lines, and actually let me put it this way, there are only certain ones that are eligible to be granted that parole. So you're not doing sex offenders, you're not doing violent offenders. If you look starting at lines 517, that's where the conditions that apply. So the parole board, should this become law, would have to follow that and limit it to those purposes or those inmates that would qualify. Part of this is to get them the care that they need, but also it's very expensive to treat these folks. And so they're just giving the parole board the ability to do that. There also, Mr. Chairman, is in the bill, a cap, I think, of 60. I will say this, that I've been approached. It seems like there are a number of facilities or entities that are open to doing this. And we're fine. I guess I'm fine in that occurring. I don't want to do an amendment now, just as it goes through the process. That I just want people to know that that is a possibility. So with that, I'm open to any questions.
Thank you. And I could not remember, is there a defined period of time in which the parolee is eligible? I mean, because there's been this discussions, we don't want someone going there getting well and then being discharged out into the community. This is supposed to be end of life type of facility. Is that correct?
Yeah, I don't know about the time period, but if starting at line 510, it defines what a medically frail individual is and minimal threat to society, whose ability to perform daily living is impaired and who may have limited mobility. So it is an end of life thing. I will say, I also know that I think the Department of Corrections is looking at doing something. This is the parole board, and I think that's from within the house. I think that this is the parole board that can make these decisions for parolees. on that. So it's not a time limit, but it's very strict as to what that person can be allowed to do.
And I believe the House has a similar type of bill. And I believe theirs may offer for additional facilities throughout the state. So yeah,
That's what I was
you
talking about.
commented on that. So let's see how theirs advances, and you can always amend yours on the floor.
Yeah, that would be good.
Any other questions? Senator Turner Ford.
Thank you, Mr. Chairman. If a facility applies or qualifies as a special care facility for parole inmates, will it be able to house or treat individuals who are not inmates? Does this designation apply to the entire facility only?
I will answer. My understanding is the answer would be no. This is being encouraged by the feds as a way to, and there's federal funds that come along with this. And so the encouragement is that it's inmates to do this. And there are available facilities out there that can be converted to address these folks. So if your question is, is it private plus, is it inmates and non-inmates? My answer would be it's just inmates.
Senator Fillingham.
Thank you, Mr. Chairman. Thank you, Chairman Wiggins. Just a question about liability. So if one of these persons is assigned by the parole board to one of these facilities, Medicaid is the one that's going to be picking up the cost versus the state. Is that
That's
the
correct.
savings?
That's correct.
Okay, so if one of these persons then commits a crime inside that facility and hurts, a fellow resident or an employee, is for liability purposes, is it the state's responsibility because they're still considered an inmate of MDOC? Or does that liability shift to them individually, or does the facility take over that responsibility? I'm just curious if, something bad were to happen, are we on the hook for that or is somebody else on the hook for that?
So first of all, in the bill, our provision is language that says Department of Corrections and the Division of Medicaid are to set out policies. So any facility that is participating needs to follow those regulations that come out. And I think they certainly could do that to address the liability side of that. Absent that, they are considered inmates. And there's nothing in the bill that I know of that would change that designation. So anything like that, I think would still be on the state on that. That being said, the intent and the language about being medically frail and all of that, the reality is I don't think you're going to find anybody in that condition to commit crimes, if that's what your question.
Well, I just know sometimes, especially in the dementia or Alzheimer's type situations, when persons start going down that pathway, some of them become very docile and easy to deal with and quite genial. Others become quite violent. I mean, I've had relatives that had to be strapped down in the beds because they were trying to beat on their, relatives that came to visit them. And it wasn't their fault. I mean, it was just a effect of the disease that they were suffering from. So I'm just curious if a nurse or a physician or someone like that gets beaten up by one of these persons, I guess what you're saying, it would be your recommendation to those writing the policies and creating these policies that they take liability issues into account and maybe shift that responsibility to the providers versus the state of Mississippi.
Yes. In short, I'm saying that if you look at lines 566, it says the DOC may enter into contracts to facilitate the placement of the inmates and shall appoint a specialist in the field to evaluate the condition. I think all of that can be covered under that. And so, yes, there is some obligations upon DOC and Department of Health, Medicaid to do that.
Thank you.
Yeah.
Appreciate it.
Any other questions? No. Entertain a motion then.
Title sufficient do pass, Mr. Chairman.
Title sufficient do pass. Motion, all in favor?
Aye.
Opposed? The ayes have it. That bill will be reported. Next is 2664, and I'm going to ask the committee's indulgence on this one and the next bill. We're still working with the department on both of these bills, trying to get down, I guess, the proper wording and language that we want. But 2664 requires Medicaid to reimburse licensed birthing centers and to seek the necessary waivers. Mississippi does not have any birthing centers in the state, so this would be a new venture for us. That's the reason need to fine tune and make sure the language is correct. Anyway, it's a real brief explanation of the intent of the bill. Does anybody have any questions? Entertain a motion then. Title sufficient do pass. Is the motion? All in favor? Opposed? The ayes have it. That bill will be reported. Senate Bill 2662, again, we're trying to work on the language on this, but this would allow for any border city that has a university affiliated pediatric hospital to be reimbursed under Medicaid. That's a brief explanation. That's the Senator Polk. You have a question?
This bill is double referred, is that correct?
Yes, it is.
So the language will be set forth before it goes to appropriations?
No, sir, the language is where it is for right now, but we're still working on it.
Okay, thank you.
Senator Wiggins?
Just to, if I understand it, and I've supported, it's that, and I'm using my area as an example, that if somebody's treated at South Alabama, who's a Medicaid beneficiary, then the Division of Medicaid in Mississippi reimburses that for that payment. Is that right?
That's right.
Okay.
They
Which-
reimburse now.
Right.
For a lot of those cases.
And there is a continual back and forth about this between the states. So this would help alleviate those issues.
It would.
Okay, thank you.
You're welcome. Any other questions? Entertain a motion.
Title sufficient do pass.
Title sufficient do pass. Committee sub is the motion. All in favor?
Aye.
Opposed? The ayes have it. That bill will be reported. Senator Wiggins says it's rise and report.
Right, I do.